September is National Suicide Prevention Month. It's a time to raise awareness of suicide. And here to tell us a bit more about suicide prevention and awareness is Dr. Tim Perry with Frontier Health. Dr. Perry, thank you for joining us again.
Thank you.
So I know that you and I were just chatting. This is the 10th leading cause of death across the nation for all ages, but the second leading cause of death for ages 10 to 24. Why is this becoming so much more prevalent?
Well, we are seeing an increase. In the last 10 years, we saw suicide increase by 16% nationally and 18% in Tennessee alone. And I think there's a lot of contributing factors to it. One statistic that's very alarming, Ansley, is that there were reported 49,000 suicide deaths in 2022, and that's the preliminary data. That, according to the CDC, may be the highest year on record for suicide deaths. So it's astronomically increasing, something that we need to pay attention to and something we need to focus on significantly as a community.
And here in Northeast Tennessee, this is one of the highest in the state, right?
It is. I think our rates, according to TSPN, the Tennessee Suicide Prevention Network, is about 20.8 rate for suicide. So we are about the third or fourth largest percentage rate in the state for suicide.
And I know that there are a lot of different things that we can talk about when it comes to mental health, but what are some signs that people can be aware of when it comes to this?
Well, there's first things I want to set the foundation for this. There are two major contributing factors to suicide. One is a sense of hopelessness, that whatever's causing my pain is not going to ever go away and I'll never have hope of it ever changing. And the other is desperation, wanting that to end, wanting it to go away. And when you put those two together, then you have a potential for a high risk for someone to go commit suicide. There are some signs we can look for. If someone's talking about wanting to die, not wanting to live any longer, not wanting to be around people, if they're starting to give away prized possessions, things that they cherish, if they're starting to have assignments of things they were responsible for to someone else to take care of, if they're starting to isolate themselves from friends and family and not enjoy the things they used to, if they're showing signs of depression, sadness all the time. Depression untreated is still the #1 cause of suicide nationally. So if they're having signs of depression, if they're difficulty sleeping, mood changes that's unexplained, if they're starting to gather lethal means to take a plan into action to suicide, like gathering pills or buying a gun or putting things together that would actually lead them to suicide. If you're starting to see someone or having those yourself, those kinds of signs, that's a concern that you may be on a path towards suicide.
And I know some people say, I don't want to intervene, or maybe I'm overthinking it. What do you say to people that might be thinking those thoughts about a friend or a loved one?
I say one is never be afraid to ask someone, because asking someone if they're thinking of ending their life is not going to plant a thought about suicide in their mind. If the thought's not already there, this will not encourage that thought, but it will give them an opportunity to perhaps hear someone that cares enough to ask. And if they care enough to ask, that other person that's having those thoughts may be willing to share with them what they're really going through. So don't ever be afraid to ask someone. If you see someone having those signs, depressed, you're concerned over them, even if you think it's just attention seeking or dramatic effect, ask them what their state of mind is, and take the statements they say seriously. Never dismiss or underestimate someone who tells you, yes, I am thinking of taking my life. Take that statement very seriously.
Well, thank you, Dr. Perry. We appreciate you for coming by to talk about this very important topic. But for more information from Frontier Health about suicide prevention and awareness, you can head on over to frontierhealth.org or call that number right there on your screen. You can also call the National Suicide Prevention Lifeline. That number and online chat line link are right there on your screen. That is available 24 hours a day.